everyone, my name is Amira Fazila and I am a student of Husbandry Science at University Malaysia Kelantan.
What is contagious equine metritis? Contagious equine metritis is a highly contagious but uncommon sexually transmitted disease of horses. The disease occurs primarily in Europe and is uncommon in the United States. The disease is caused by infection with Tellerella equigenitalis bacteria, also known as the contagious equine metritis organism. It is primarily transmitted at mating, but contaminated instruments and equipment also play a role. Stallions show no signs of infection and carry the bacteria in the prepuce and on the surface of the penis, especially in the opening of the urethra. The transmission rate is very high. Virtually every mare mated by an infected stallion becomes infected. Etiology: Contagious equine metritis is caused by the gram-negative microaerophilic Coccobacillus Tellerella equigenitalis, also known as the contagious equine metritis organism. Important strain differences exist. Some strains are resistant to streptomycin, a fact that helps isolate this fastidious, slow-growing organism from contaminants, whereas others are sensitive to streptomycin. It is best cultured on chocolate Yukon agar at 37 degrees Celsius in an atmosphere of 5% to 10% carbon dioxide in air. Tellerella equigenitalis is asaccharolatic but is positive for catalase, cytochrome oxidase, and phosphatase and unreactive to other conventional biochemical tests. Clinical signs: In mares, a copious mucopurulent vaginal discharge is seen 10 to 14 days after infected matings. Mares may return to estrus after a shortened estrus cycle. Although the discharge subsides after a few days, mares may remain infected for several months. Chronically infected mares show no signs. Most mares do not conceive at the time of infected mating. If they do, they may infect the foal at or shortly after birth. Foals so infected may become carriers of contagious equine metritis organism when they reach sexual maturity. Diagnostic: Diagnosis depends on isolation of the causative organism. Although other bacterial infection of the genital tract of mares may produce a conspicuous vaginal discharge, this is uncommon and no other venereal pathogen of the equine reproductive tract is contagious. In mares, swabs for culture should be taken from the endometrium, preferably during estrus, and from the clitoral fossa and sinuses. Swabs from suspected stallions should be taken from the urethral fossa, the urethra, the preputal cavity, the shaft of the penis, and, if possible, the pre-ejaculatory fluid or ejaculate. Stallions should be sampled at least 3 times before being declared free of contagious equine metritis organism. Test mating suspect stallions to susceptible mares that are then screened bacteriologically constitute a satisfactory way to determine contagious equine metritis status. All swabs should be placed in a transport medium, preferably amines with charcoal, kept on ice at 4 degrees Celsius and delivered to a qualified laboratory within 24 hours, or frozen if transport will take longer. A variety of serologic tests has been developed, but none is yet capable of reliably detecting the carrier status.
We're required to clean the penis, and what we'll use is a chlorhexidine scrub, and then following the cleaning we'll pack them. The horses can be treated following the breeding of the second test mare. And so with the chlorhexidine scrub, again, ideally you want the horse to have a very good erection so that we can clean the entire penis. You need to do a good job up in the prepuce region where there's a lot of schmegma. Penis, when it's erect, into the urethral fossa. You see again in the diverticulum, we have this schmegma here, and we'd like to get that out so that when we do coat the penis with a nitrofurazone, which is what we're going to do next, we can coat the entire penis and pack in the fossa, in the diverticulum. And that treatment is repeated for 5 days.